Good morning. It's with great regret that we have to show up down here again this morning in your continued ideological sacred cow mission to promote abortion that harms women and kills babies. Abortions harm women and kill babies. We have no business as a city, we have no business as taxpayers paying for this illicit, immoral, destructive policy. How terrible of you to even reconsider it. We were here on January 23rd. Before that, we were here on November 21st at City Council chambers. You voted no. It's continued. We filed a lawsuit against the city. It's costing taxpayers more money because you continue to violate state law. You continue to engage in discussions of policy that are regarded at state law. They're not city business. Get back to the business of the city charter. Get back to public safety, infrastructure, clean water, sewage, drainage. You're off the mark again. Stop your ideological bias. You're going to harm the citizens. You're already harming women. They don't need transportation. They need care. They need love, and love them both, baby and mom. Dads need to take responsibility for themselves. There's resources at SanAntonioFamilyAssociation.com. We'll be glad to help. We're helping every week. People need help. They need love. They don't need money to destroy their lives, to destroy babies. You're violating state law. I see a mayoral candidate here to come speak about this. She wrote a letter and submitted it to this committee on January 23rd in full support of this abortion travel fund. We had a split vote last time on January 23rd, 2, and 1. And I don't see one of the members here, but I hope you defeat it again and don't pass it on. Thank you very much.
Thank you. Up next, Adriana Rodriguez, item 5.
Candy Miller, Amber, Rawson, and Nevaeh. Texans we know who have died because of abortion bans, and we know there are many names and stories that we will never know, that will never be spoken in areas like this. I'm Ariana, and I'm the Youth Advocacy and Community Engagement Manager at James Due Process, and I stand here today for our clients who are terrified and lacking access to care. We see this as an important resource for the city to provide so our communities can thrive. Whether it's keeping our parks clean, upgrading our libraries, or building affordable housing, the city has invested in those initiatives because they know people thrive when they have clean spaces to raise their families and enjoy. We see this investment in reproductive and sexual health care as an extension of that. When people can get tested and choose when they want to become parents, they are better able to mentally and financially enjoy our clean parks and enjoy our library resources. Without the power to decide when to become parents, we know our communities will face more hardships and not be able to participate fully in the communities as they want to. James Due Process is very fortunate to have advocated for this in the city of Austin and have been awarded that money. We know there is fear when it comes to this funding, and I ask, how many times have we been scared but knew and pushed through because it is the right thing to do? The city of San Antonio is proud to lead on innovation and knows it's important to step up when people are suffering. And I ask, what will we do right now when our people are suffering? Thank you.
Thank you. That is all who we have signed up for public comment. We can now move into item 2, measles exposure and response, presented by Dr. Kirian. Dr. Jacob.
Good morning. I just want to take a moment to thank the council for this invitation. I know this is a last minute adjustment to the agenda, and we have a hat trick today because we have 2 other items sitting on the agenda. So I do want to publicly thank Dr. Kirian, our deputy director, and our fantastic team in the department, and the residents and our partners on the ground helping us address what has been another example of the importance of governmental public health and action. So with that, let me introduce it and let me turn it over to Dr. Kirian.
Good morning, committee members, chair and committee members. As you all know, the measles outbreak, the measles outbreak that's centered in West Texas that continues to grow. A person that was from one of these outbreak counties had visited several locations in St. Marcos, New Braunfels, and San Antonio area over the weekend, over the Valentine's Day weekend. So today's briefing will be providing a situational report on these exposures, as well as importantly our public response to these exposures. And before I go any further, I want to acknowledge the key staff members who are involved in this outbreak investigations along with me in lockstep. Miguel Cervantes, he's our public health administrator. He oversees our immunizations and STI programs. I also have Administrator over Marcom, Sonia Gonzalez, leads a robust team of marketing and communications team at Metro Health. We have two other key members, stand up please. They don't get the recognitions very often. It's the program managers for epidemiology division, as well as the immunizations. Epidemiology is led by Krishna Carmona, and immunizations is by Michelle Parker. Michelle Gilstrap. We have too many Michelles in public health. And I also want to give a shout out to the A team that we left behind, who are actually doing the work behind the scenes. They work very hard every day to safeguard this community's health. So thank you so much for what you do. Okay. So here's the timeline of events that happened with these exposures that we are talking about today. On February 23rd, this past Sunday morning, the Texas Department of State Health Services informed us about a potential exposure in our community involving a Gaines County resident who tested positive for measles and had visited and landed up in our community and you'll see the time. So based on the clinical history that was given to me, the period of consciousness for this person is February 15th through February 24th. The person arrived in our community on February 14th. And this person, while infectious, visited all these locations. These are large public locations leading to large community-wide exposures. The person visited on the 15th, visited UTSA campus between 10 to 2, visited several locations, several attractions at the Review, the Max Museum, the Ripley's Believe It or Not, and Ripley's Illusion Lab from 2:30 to 5:30 p.m. And then ended the day on the 15th by dining at Mr. Krabby's Seafood in Live Oaks, and the exposure there was from 6 p.m. to 8 p.m. This person then left San Antonio the following morning, and so based on the history that was given these three locations, we consider these three locations as where we know community-wide exposures might have happened, because it is very possible that this person could have come in contact with, if not hundreds, but thousands of our community residents as well as visitors. We are a destination city. So we did have real great concern of potential large community-wide exposures at these sites. Hence the need to alert the community promptly, and this was done later on the same day on February 23rd. This was the day that we were initially notified. We had contacted the place that the person was staying while in San Antonio, and a detailed investigation and history was taken from the staff as well as other patrons, and we did not identify any possible exposure at this place of stay. Hence, this was not listed publicly in our press release. Because measles is highly contagious and it can linger in the air for quite some time, for up to 2 hours, even after the person has left. Especially in close confined spaces, you see those exposure periods being extended by 2 hours beyond the infected person's visit times. Some people think measles is just a little rash and fever. It can clear up in a few days, but I just want everyone to understand this is a highly infectious condition. Right. It's a highly infectious condition. 90% of folks who are unvaccinated, who come in contact with a confirmed case, can break down with the disease, can get the disease. So this is a pretty serious infectious condition. It spreads through air, it's airborne spread, and it spreads through air when the infected person coughs or sneezes. And it is so contagious, you can just get that by being in the same room as the infected case. Like I mentioned earlier, the virus tends to linger even 2 hours after the infected person has left, so it is highly contagious. The symptoms appear typically 7 to 14 days, and in some instances, up to 21 days after contact with the virus. And the most common symptoms that you see are those listed up here: high fever, cough, runny nose, red watery eye, pretty non-specific to begin with. And within 2 to 3 days of this initial onset of symptoms, you tend to see white spots in the mouth, and within 3 to 5 days, the characteristic measles rashes appear. These rashes are flat, small, red rashes, typically begin in your hairline, face, and then spreads to the other parts of the body. Rash can persist about 5 to 6 days, and then they fade away exactly in the same order that it appeared. Anyone who's not protected against measles is at risk. So if you're not vaccinated, if you don't have immunity that is either vaccine-induced or natural infection immunity, you are at risk to contract this infection. It can cause serious health complications in folks who are at high risk for complications, and those are children, babies and children under 5 years of age, pregnant women, folks with underlying medical conditions and weakened immune systems. In babies under 5 years of age, the most common complications that we see are ear infections, diarrhea, and we can also see serious complications if not managed appropriately and in a timely manner. It can lead to pneumonia and encephalitis, and the fatalities that we see with measles are typically because of pneumonia and central nervous system, CNS abnormalities and complications. Like I mentioned, the best protection against measles is the MMR vaccine. It's a safe and effective vaccine that provides long-lasting immunity, and the recommendation is to have 2 doses. 2 doses of MMR vaccine as a child. As a child, you should have received 2 doses of MMR vaccine. It is 97% effective against preventing measles. 1 dose is 93% effective. Now, as a child, the first dose is given 12 to 15 months of age. The second is 4 to 6 years of age. Now, older adults, they may receive 1 dose, and you're still considered up to date with vaccines, with your MMR vaccination. Here's what we are seeing nationwide. This is the cases and the outbreaks in the United States. Now, measles was considered eliminated in the United States in 2000. Now, since COVID, we are seeing a resurgence of measles and outbreaks here in our nation, and this is primarily because of 2 reasons. Globally, measles cases are increasing, so whenever there is increased activity globally, I always say that measles, threat of measles, or a case anywhere is a threat everywhere. So it can easily spread into other communities, especially communities with low vaccination coverage. And this is the second reason since COVID why we are seeing a resurgence of cases and outbreaks, because the overall MMR vaccination coverage nationwide has fallen below the desired target vaccination coverage rate of 95%. At this time nationally, we have coverage rates approximately about 92.7% with regards to MMR vaccination coverage among kindergartners. So what you see, the map that you see on the left-hand side, it's the cases and outbreaks in 2024. In 2024, the entire year, we had 285 cases in 33 jurisdictions in the United States with 16 outbreaks. In contrast, look at the map on the right-hand side. That's the map of 2025, and it is just February of 2025. We are already documenting over 100 cases nationwide, and with 3 outbreaks, 3 large outbreaks. Here's what the situation here is in the state of Texas with regards to measles cases. And everyone knows this. We currently have a very large outbreak going on in the South Plains regions in Texas. But the first 2 cases that was reported here in the state of Texas was from Harris County. And that was the first confirmed reported cases in Texas since 2022. Now, this particular large outbreak that's ongoing, and we expect these numbers to change. The state is updating these numbers on a weekly basis. As of this morning, we have 146 cases from this outbreak, and I expect these numbers to go up exponentially, especially because of travel to and from the community, as we saw with the exposures that happened in our own community. 2 days ago, on February 26th, Department of State Health Services reported the first fatality in this growing West Texas measles outbreak, and this was in an unvaccinated school-age child. Again, a great reminder that this can be pretty serious for young children in the community. As far as Bexar County goes, we've had 4 cases in the past 20 years. Our last case was in 2019. We had 1 case in 2019. Prior to that, 3 cases in 2007. These 2 instances were travel associated. We did not see any widespread transmission of these cases as a result of these two instances. And that was because we had pretty high vaccination coverage in our community among first graders and kindergartners. It was close to 95%, if not higher in certain geographic locations of our community. At this time, our current MMR vaccination coverage among kindergartens is falling 1% below, 1 percentage point below the desired outcome, the desired target of 95%. And what's more concerning is there are certain pockets or certain geographic locations within a community, like the South and the West, where even though overall it may be, the vaccination coverage may not look bad, there are pockets with very low VFC provider coverage, and these are cause for concern, and we are intensifying our response efforts in these areas. And I'll talk about that in this slide. So here's since the exposure, or since February 23rd, when we got the initial notification, there has been a flurry of response activities, which I would group into these 3 focus areas. First is surveillance and public health investigations. This is the cornerstone of all public health response. It's twofold. First is we begin with timely contact investigations to identify all exposures, implement control and prevention measures to prevent the further transmission of infection in our community. That is the goal of all public health investigations, to prevent the further transmission of disease in our community as quickly as possible. So the day we were notified, I had a call with UTSA, which was one of the exposure sites, notified them, made them aware of this exposure, gave them all the recommendations, and offered any assistance they might need. UTSA is pretty self-reliant. They have a robust student health services. They have infectious disease consults on staff, so they manage their exposures themselves and did a good job. They did lots of notifications to their staff and students and faculty pretty quickly. We also contacted the other exposure sites, the Riverwalk Attractions and Mr. Pravi's restaurant, and identified some exposures, and we have identified up to about 20 contacts, close contacts that fortunately majority of them were vaccinated, but they have been contacted, notified of their exposure, and educated on what to look for. Right? So essentially what we're doing is asking these contacts, regardless of your vaccination status, please monitor, self-monitor for symptoms for up to 21 days. And fortunately for us, none of them have broken down with symptoms, and they are doing well. But every day we get about 60 to 80 calls. We are vetting those calls pretty diligently. The other step in our first response effort is identifying new cases. This is, again, our goal to prevent the further spread of the disease. We can only do that when we identify new cases as quickly as possible, because every single case that emerges, it can result in about 12 to 18 new cases among unvaccinated. And this is how it gets widespread and gets hold of. It gets a strong hold in any community. So our goal is to identify these new cases as quickly as possible, and we are able to do that because of because measles being a reportable condition here, not just in the state of Texas, but nation. What that means is healthcare providers, doctors' offices, hospital systems, school nurses, infection controls, ME's office, labs, anybody who makes a diagnosis of measles are required by state law to promptly report that, immediately report that to local public health department. So what we do as soon as we get the notification is reach out to the case and do a detailed investigation. And the goal of the investigation is always establish the infection timeline, identify the source if we can, identify all those exposed, and then implement control and prevention measures promptly. The second focus area of our response is developing guidance and recommendations. We have developed guidances and sent out health alerts to our local healthcare provider community. 2 of them were already sent out. We get calls on, and we do consults on infection control, testing recommendations, isolation practices. So most of the providers, we work very well with the hospital systems and the clinicians and the doctor's offices here in our community. And those are ongoing every day regardless of this particular exposure. We developed a guidance document for first responders. It was distributed to PD, EMS, fire, essentially again alerting them to these exposures and giving them some guidelines on infection control, guidelines and precautionary measures that they can take should they encounter a case out while they're patrolling our streets. And then we work very closely with school nurses. In fact, Christina and her team attended a school board. It was the East Side School Board, Northeast Side School Board Advisory Committee. And they had a lot of questions which we were able to address. We also have reached out to the Region 20. We are having a town hall with school nurses that's scheduled for next week. We have another one with school administrators scheduled for this next Friday. So we are moving at warp speed with regards to our response. We are also offering opportunities to host vaccination events, should there be a need. But fortunately, our kindergartners are pretty high, even though it's not the desired target, they are pretty highly covered with regards to MMR vaccines. But we are keeping that option open. We also developed various guidance documents for the general public. The FAQs have been developed, and all these resources that I'm listing out are all updated on our website. That FAQ is a living document in daily basis, collecting questions that come up that we encounter either in our clinic or CHWs or CHPs walking the streets, any questions that they encounter. And if it's not covered in the FAQ, do take a look at it, and it's updated. So that's why I say it's a living document. We update it on a daily basis. The third focus area of our response is outreach. We have reached out to our ICSA, which is Immunize SA partners. This is a big partner stakeholder committee that assists us with our vaccination efforts, with our immunization efforts. And I am so glad to say that each one of them have responded vaccine. They are willing to assist and willing to collaborate, hosting pop-up events if there is a need. At this time, we are able to manage the capacity, mental health capacity to handle the pop-up request. But should we ramp up our response, we have already, in anticipation of ramping up our response, we've already reached out to these partners and they are standing by and willing to assist. We are also looking to host more pop-up vaccine events, especially in those areas that I said has low VRC provider coverage, right? So we already had one event this week. There's another one on I believe this Saturday at Fortes Library. And the easy wins for us is reaching out to the partners that we worked with during COVID-19 to have these pop-up events. So we have reached out to all the libraries. We have reached out to some of the churches that were our own partners, asking to see if we could host pop-up events pretty quickly. And as and when we finalize these details, it will be posted up on our website, the location, the timings, and the dates as well. And then last but not least, we have a very robust, like I said, so yes, a robust marketing and communication effort that is ongoing. Even before this exposure, we had already launched a massive vaccine campaign, which is Riskless, Do More. We had several measles prevention and crisis communications through our social media and various other channels, modes of communications. Since the exposure, the news stories was widely publicized, were widely picked up by all forms of media, and you see all those share some impressions listed out there. We will soon start, and this is going to be pushed ahead of the scheduled time. This was supposed to be released sometime later in March, but this campaign is a new campaign. This is the HHS campaign. Let's get real. That will be launching pretty quickly ahead of the pre-scheduled time. And then, of course, as usual, we will continue to update our website, continue to update the community, keep everyone aware of what's going on. And these are some of the resources. We have great resources on our website. We have links to the state and CDC website. And that pretty much concludes the presentation. Thank you so much for your time. Happy to take any questions.
Thank you so much, Dr. Kareem, and to the mental health team for quickly bringing this item as cited. It was a request a couple of days ago, but I think that you all be prepared to present demonstrates the infrastructure and framework in which mental health department is prepared and doing the work, whether there's exposure or not. That work continues, and it's great before the mental health team and all that they do in ensuring that we're safeguarding our community. As Dr. Kareem mentioned in the presentation, there was exposure that had been reported in the media, and out of abundance of caution, we thought it was important to request a briefing because I know my team is still getting calls from constituents that have general questions around measles exposure and what processes are in place in terms of getting access to vaccinations. So just thank you all so much for being prepared, as always, to equip the community with the information. In terms of some of the numbers that we're seeing, and I know that they're changing, and you touched on it in terms of the impact that this can have on children in particular, and especially if they're unvaccinated. I'm curious to, and I know you mentioned it too, you're already talking to independent school districts, already presented to independent school districts, but I'm thinking about our pre-K for SA students, and what work is being there to ensure that we're mitigating any potential, and I know we're not there yet, right, but in the case that there is, what steps are we taking to ensure that there's a plan for our little ones at pre-K for SA in terms of potential exposures?
So that's one thing I forgot to mention. In the schools, when we're doing those outreach to schools, we are doing outreach to schools, childcare facilities, and for SA as well. We are in constant communication with them. In fact, we will send them the guidance documents for childcare facilities and schools with regards to infection control. So we are in constant communication.
Thank you. And you answered one of my questions in your presentation, because last night at a neighborhood association, I was asked, how is all this information relayed from one entity to another? And you emphasized that whether there's an outbreak or not, that it is information that is shared by an entity. So can you just walk us through that piece one more time in terms if you go get tested, how that's they're required to relate it to the mental health department?
Right. So I'm going to take one step back from the testing. The bread and butter of all our surveillance activities is those reportable conditions list. We have about 77 plus infectious conditions on that list. And that list is the one that I was referring to, where any provider, any lab, any school nurse, any's office, anybody who makes a diagnosis of any of those infectious conditions are required by law to report to the local public health department within that designated time frame. And I have to say, I'm very proud of this community. We have a great compliance with our hospital systems. They are also part of our public health system, right? So we have a great partnership and collaboration with our hospital systems, with doctors' offices. Christina's team is pounding the pavement all year long. We're educating these doctors' offices about these reportable conditions. Infection control nurses are pretty much calling regularly. So you hear us talk about all this only when there is a crisis, but this is the work that is ongoing year-round behind the scenes. We get about 60 to 80 calls on any of those conditions on any given day. And then following an outbreak, those call volumes go up. So we are working, and if you don't hear from us, it is a good thing. You hear from us only when there is a crisis or an outbreak. And does that answer your question?
Yes, ma'am. And during the 3+9 briefing, one of my colleagues, Councilwoman Vita Gunn, mentioned whenever we experience an emergency or an outbreak, we know that it's primarily concentrated in specific areas. And I appreciate the assurance that you are going to lean on the COVID partnerships that were established, because we know where those exist, right? It's primarily in the south side, west side, and east side. So again, right, I are already having those ongoing conversations with community partners. Those are my questions, and I'll hand it over to my colleagues. Councilman Tezgita.
Thank you. Thank you, Dr. Korean, for coming and presenting. I know you're doing a great job, but I always hold my breath when you're coming up because I know it's going to be something where it's like that list of 77, because I've heard you say that before, and I was like, and then I want to look at the list, and I'm like, don't look at the list, she'll come when she's supposed to.
So the moral of the story, Councilman, is imagine back when the times are good, right?
Yes. So I spent the morning with Carlisle Independent School District. It was a great way to start the morning. They were doing a resource fair for children with disabilities. But as I'm there, I know I'm walking away having this update on measles. And I'm like, and I'm telling some of the health workers there, it's like, it's 2025, and I'm having to go get an update on the measles outbreak. And we're all like, people need to get vaccinated. And I so much appreciate your efforts and applaud what you're doing. I think the one thing we also need to communicate, and Claude, and I know the communication team is out here, is when we talk about the vulnerability, especially for children, and children on the south side, which we have juvenile diabetes. There's a lot with asthma. There is cancer in and around those communities with teenage, lots of people, but I know it impacts our youth and the teenagers, it seems to. So I want to make sure that we're getting the message out of who can get vaccinated and when, and the information they need to have. The other I'm concerned about is that a lot of people during the, not a lot of people, some people had children during the pandemic, started to expand their family. And I think those are the ones that we need to make sure, are you up to date on your vaccinations with your child? Because the risk is real. We know that environmentally, it can easily spread. And we learned from, I believe, the pandemic that people don't always wash their hands like they do or cover their mouths when they cough. So I think it's really important that we get the message out to make sure that they're moving. On slide number 3, if we go back to slide number 3, so this dark blue, which is in Texas, that is because we've reached over 100 now in 2025.
It's the other slide, right? Yes.
Oh, I'm
yes,
sorry,
yes,
4.
yes.
I'm sorry, 4.
Yes.
Yes. Okay, so
We have, as of this morning, we have 146 cases recorded.
And my concern is, and I don't, is it's going to be spring break. And I looked at some of those counties, and I'm like, okay, students from those counties are going to come back home to San Antonio or back home to their bigger cities. And I'm glad that we're getting ahead of this, but I think we need to, and I know that y'all are doing that, prepare just for the case to come here. Because the counties that and we already learned this with this past report on the outbreak, is that people from these counties are coming home from school, are visiting San Antonio because it's spring break, and it's a tourist destination spot. So how do we prepare our local community to make sure that they're masking up if needed, or what they can do because it is highly contagious, and making sure that they understand what their vaccination status is. Sign me up for the pop-ups in District 3, and I'll work with you with all. I mean, we have a lot of school districts. I know they're very helpful, but I do have kids getting homeschooled, kids in charter, kids not in pre-K yet. So please let me know what my office can do for the pop-up, and just as we look through the updates, when can we, and I know it's hard for you to answer, when should we expect an update? Like, are you just going to provide that on the website via dashboard, or will you send, or will our media that's here probably ask you the question and then get that out there?
We can have something, Mr. Curry can work out something from regular briefings. expect to see any cases coming out of these exposures by March 8th. This is taking into consideration the incubation period. So that doesn't mean we cannot have other cases of measles, right? Measles, we can have some international traveler who's coming, not necessarily associated with this exposure. But cases with these exposures are expected from now until March 8th. So if we don't have any cases associated with exposure active, don't have any cases until you want to hear from us. We do have, like I said, it's not just these cases associated with this exposure, contacts associated with this exposure that we are investigating. We do this year round. So people are traveling globally. Globalization is real, travel is pretty easy. So we do get these suspect febrile rash illnesses report. And we do have a few handful that we are monitoring. We coordinate testing with the providers, and we don't jump the gun and come on and talk about the suspect cases unless we have all the facts straight. So if we have a confirmed case, absolutely you'll hear from us. And with regards to vaccines, I just want to say I'm a big believer in vaccinations. Surprise public health professional, right? But vaccines have really significantly improved childhood survival. There's an interesting study out in Lancet. I think everyone should read it. Past 50 years, vaccinations have saved close to 150 million lives. That's big. So yes, everyone should review their vaccination records and be up to date with their vaccines. And I want to take this podium to send an urge to the community. We say this in every phone call we get. If you are sick, please stay home. Exclude yourself from public settings. Don't go to North Star Mall, or don't go to the movie theater. Don't go to, large restaurants. Don't walk on the riverwalk. If you are sick, please exclude. Don't go to schools. Please exclude yourself. Get evaluated and let us rule out, along with your provider, rule out any infectious diseases like measles that could be highly contagious and putting thousands of folks at risk of exposure.
Thank you, Chair. Thank you so much, Dr. Kirian, for the very informative presentation. Do you have a breakdown of the current vaccination rates amongst some of our most vulnerable residents in San Antonio?
I don't have that breakdown just yet. It's very difficult to get that because vaccines are a requirement for K through 12, so we have a good handle on that coverage, which at this time is about 94.2%.
Do you remember or do you know when Metro Health started providing vaccinations, access to vaccinations in San Antonio?
I think for the past 35 years.
Okay, so I was just trying to make sure then that we had pretty good steady records, and it looks like. Okay, and then can you remind me how long it took for you to inform on this first case or potential exposure? How long was that? How long did it take you?
I was notified during the AM hours, early mornings on Sundays, and all public health crises begin on Fridays and end on Mondays, right? So on Sunday morning was the notification, and by 5 p.m. on Sunday, we had notified all potential sites of these community-wide exposures and send out a press release.
And I wanted to highlight that, and I just wanted to take the opportunity to say that I appreciate you all, because while there's other departments in the city that don't work on holidays, or that say, oh, it's Sunday, I have to get back to you on Monday, Metro Health's always working. And so shout out to all of your healthcare heroes that you have, behind you. And I think that's one of my frustrations. Like, we as elected officials, we work 24/7, and we're expected. And so, especially in times of crisis. And so, again, I just can't tell you how much I appreciate you all always being there for the community. On the children's immunizations that we're providing, are they free? And if they're not, how much do they cost? Help me understand. I know that there's like chip available, but help me get the message out to our residents.
So MMR vaccine is widely available, easily accessible, and covered by most insurances, right? So the vaccines we provide on our clinic are through the VFC program, Vaccine for Children's program, and through the Adult Safety Net program. And these vaccines are targeted specifically for those uninsured and underinsured folks who don't have insurance to come and get those vaccines. So if you're insured, go to your pharmacy, go to your doctor's offices, leave the opportunity to provide that service at public health clinics and pop-up events to the uninsured and underinsured, because those vaccines we get from the federal government and the state government at no cost. We charge minimal administrative fee, which is, I think for VFCs we charge $14.76, something like that, and for ASN 22. But one thing I want to say, we never decline services because of somebody's inability to pay even that nominal administrative fee.
Wonderful, thank you so much for that. Dr. Kurian, another question that we have been getting as, this continues, and in Spanish it's called sarampion. And so I get that question from a lot of the population that I've been representing, and they're trying to tell their neighbors not to be afraid to come to Metro Health if they need that service. And so help me understand, like, what do you ask for when somebody comes to ask for vaccination? What kind of identification do they have to provide, et cetera?
We expect you to bring your vaccination records, because we want to make sure we're giving the right vaccines. You've already received it, there's no point in revaccinating you with something else. At minimum, bring in your vaccination records, but if you don't have that, we do, like I said, we never turn folks away. We have a way of looking up for your vaccination records if you don't have it, especially if you've received vaccines here in the state of Texas. So if you have your vaccination records, please bring in, and this is just so we can serve you better.
Got it, the birth certificate, what do they have to show?
For vaccination records, no. For receiving a vaccine, we are not that stringent with the VFC, and it's as long as we have some records on how old you are or how old the child is, I think that should be, but it's not a requirement to receive services.
Okay, thank you, I appreciate that. And then I appreciate you already meeting with Region 20. I know that you have that coming up as well. Would it be helpful for us to have just like a common messaging? I know that you all did provide something, but just kind of like updates. I know that the community is just worried and hyper aware, and so any update that you have that we can share on like today's numbers, et cetera, like, do you think that it would be helpful as maybe cases start going down, et cetera?
We don't have a case yet here in the committee. You're talking about state of Texas cases. We certainly can make those arrangements, and like I said, the FAQ is a living document. Every time we make an update, we can make arrangements to send it to all consular offices, and you can disseminate it further. It's always being posted up on our website as well.
Great, thank you so much, Dr. Kieran. Thank you.
Councilmember Dr. Ford.
Thank you so much, Chair, and thank you for this presentation. I want to echo Dr. Garcia's comments that you all are a super important department that does work day in and day out, and not that any of us have favorites, but we do all really appreciate the work that you do. I know Dr. and you all get a lot of accolades from us. I actually had that same question about data, so that from the 94%, is there a way because if I'm a parent and I'm enrolling, I can waive my right to submit vaccinations. Is there a way to access from schools that information to have conversations with those parents?
The vaccine exemptions?
Yes.
Thanks for bringing, that's a very important point to bring up. Texas is one of the 16 states in the nation that has very broad vaccine exemption slots, right? Most states allow only medical exemptions, but we are one of those 16 states in the nation that allow, in addition to medical exemptions and religious, also conscientious exemptions, which is pretty easy. A parent can do an affidavit and object to it, and that is acceptable. And this is a real threat for us. This is cause for concern. If you look at the vaccine exemptions data from 2013 up until recently 2024, in 2013 the exemption rates were 0.79%, way below 1%. Currently it is close to 3%, 2.81%, and that is because of these broad vaccine exemptions laws.
And how many of those do you know how many were those conscientious?
I can get it. I don't have it at my fingertip. Yes, we can get that. But again, like I said, vaccinations are important. They save lives. We've been able to eliminate or eradicate deadly infectious diseases like smallpox because of vaccines. So it's very important.
Is that protected information though at the schools? Like, can the schools provide you all with the list of families that have submitted those?
That is confidential information. What we get is the overall rates, not the breakdowns, yes. And it's available at the TA website. If you are wanting to know by school districts, they'll tell you.
But it's protected on who's submitting,
Yes.
so you don't know. But the school leaders technically would know.
Yes.
So that's why with your campaigns, when you're going to the schools and sharing an outbreak situation, they would know who to directly reach out to.
School nurses are already reviewing their vaccination status among their student population, and this is done because should there be an exposure in the school, they should immediately identify who's at risk for exposures and disease. These are unvaccinated children, and if there are unvaccinated exposures at the school, our recommendation is regardless of symptoms, whether you're symptomatic or not, if you're unvaccinated, you have a confirmed case in your school, you are to be excluded for 21 days from your date of last exposure. So school nurses are already prepping, reviewing their vaccination records, identifying who might be at risk, even before we have a crisis at hand.
The challenge there is a lot of schools don't have school nurses, so it's like you have the
That's
job
true.
of a business secretary.
That is true.
But that's not for this committee. But the next question I wanted to just ask and commend you all on is the education awareness. And I think a part of the reason why that's even more important is because we see this increase in rate of people choosing not to get vaccines because of the media praise on the side of that they're not helpful or they're not needed. And so, have you all thought about like doing a concerted effort? And I know you all are already in terms of like the signs that you said on that slide, but like getting creative with different types of education awareness. Like Ryan on my team was doing some research, and there was like different offering incentives or gift prizes, or maybe even having like a vaccine education center where people come to. These are some ideas that other states are doing.
No incentives at this time, but we are using that's one of the campaigns we're working on, using influencers, folks that community, they have some credibility within their community, and me coming saying get vaccinated is completely differently perceived than somebody who lives in the community, is trusted messenger of that community. So those are some of the educational campaigns that we're working on.
I love that. Yeah, I think continuing to even maybe partnering with the business community to see how they can host, fun events and things like that. Because I think we have to get even doubly creative now, given the opposition coming. That's all I have. Thank you so much, Chair. Thank you so much.
Thank you. Councilman Dr. Rivers.
Sorry, I forgot one quick question, Mr. Chairman. Is there any way that we can, maybe focus on medical desert areas and make sure that we have vaccine access there?
And that's exactly what I meant by when I say low VFC provider coverage. Because these are the providers who provide service to the uninsured and underinsured, right? Folks who are insured can get access in pharmacies and doctor's offices. So we are targeting actually those.
Okay, thank you, Chair.
Thank you, Dr. Green. We appreciate y'all presenting to us today to demonstrate to the community that there are safeguards in place, and you all continue to do the work, whether there's exposure or not. You are behind the scenes building those calls and collecting data and sharing information. So thank you so much, and thank you for your contribution.
Thank you for the opportunity, and we don't lie when we say we don't sleep, we do.
again. Good morning. Jacob from Metro Health. Thank you again for the opportunity to provide this update. We just heard, again, saw an illustration of public health in action. This topic is, I at least want to tee it up. This is a familiar topic for this group. Just know that we appreciate the opportunity to provide this brief overview to frame the context of this morning's discussion and to assist you with the request that was issued by the council since last fall to consider a supplemental appropriation to support our ongoing reproductive justice efforts. This presentation outlines the current landscape and factors for your consideration and the request to add downstream reproductive health services for area vendors and local service providers. I am joined by Sean Elliott, Director of the Finance Department, as well as Dr. Jim Wu, Medical Director of the Local Health Authority. I'd like to also add my thanks and appreciation to Dr. Wu, as well as Sian Elmore, Administrator of the Access to Care Office, for anchoring this effort in our department, and will be available to answer questions at the end of the presentation. So, again, this is, you've seen this before, this is a snapshot of what's being done in other cities across the United States, and it's not intended to be an exhaustive listing, reflecting cumulative amounts based on our own research. As you can imagine, again, given the transition to the new administration, this situation remains very fluid across a myriad of states and jurisdictions, including here in Texas. So keep in mind that the amounts refer are really just a snapshot. Some places they read reproductive justice, or reproductive equity packages. The funding for health education and OBGYN access exists across various municipal budgets, programs, and initiatives. There may be a variety of funding streams to support these related activities, whether it's anchored to the local taxes, the general fund, area foundations, etc. So this snapshot is really intended to illustrate the varying levels of investment across various cities and some common areas of alignment. For example, primary prevention efforts anchored to health education, improved access to wraparound services and care, as well as access to abortion care, which could include navigation care or safe travel. So again, this is a familiar framework. Given the new request for supplemental funding, here are some examples of what could be considered downstream reproductive health services. Again, a reminder that upstream work aims to increase economic stability as well as maintaining healthy relationships, while midstream services may include enhanced access to trusted medical care as well as a full range of family planning services such as sexual health awareness and reproductive health education. So by contrast, the downstream services focus on more direct care. This slide shows a list of examples that may be applicable using this framework. And as a reminder, the exact language in the original RFP that we released last year, we have downstream reference activities that will fill a demonstrated gap in direct services for prenatal care, STI care, or abortion transportation to the extent permissible by law. So again, just a reminder of what we've already done here on the ground related to the adoption by council last fall for additional context of the investments and commitments already underway. This is a reminder of where we landed with the first request from the City Council calling for the establishment of a dedicated fund in response to the Dallas City. You may recall that the evaluation panel recommended a total award of $499,179 to 4 vendors. Empower House, Latch Support, the San Antonio AIDS Foundation, and the YWCA. These organizations are often running for their year-long efforts now underway. Their contracts were approved by City Council this past November and will expire later this calendar year on November 30th of 2025. I wanted to share a few highlights of what's been reported to our department based on activities that have taken place over the first couple of months of the implementation of this initiative. So for example, Latch Inc. received 59 applications for their 10 available spots for doula training. The YWCA and Powerhouse collaborated on a curriculum for reproductive health workshops on prenatal care, contraception, and STI prevention. At the YWCA, there were 4 community health workers who completed their doula certification. 17 individuals were navigated to prenatal care, and 48 individuals were navigated to STI care, sexually transmitted infections services. The San Antonio Area Foundation performed 69 screenings in December for women and individuals with female reproductive organs. So, with this, in our first request for proposals, transportation to abortion care services was one of the available options We assessed where the gaps were in reproductive health and invited vendors to devise and propose solutions. In the end, none of the 4 recommended awardees proposed abortion transportation or navigation. 2 respondents included these services as an element of a broader package. Again, at that time, BDA's Coalition Plus and Parenting Plus. Parenting Plus did advance to the interview phase, but was not recommended for final award. Abortion navigation was not addressed by any of the other respondents. Again, the contracts were approved by City Council this past November 21st, and we have been underway. Since then, as you heard during public comment, Councilwoman Correa-Hopper submitted a memo on November 22nd to address this specific need based on the feedback from council. This slide shows highlights from the memo. The request is for an additional $100,000 for downstream activities not yet addressed. This proposal is to limit the solicitation process to the 10 original applicants using the same scoring matrix from the previous round of this initiative. We understand that this additional allocation is expected to have a quick turnaround with a 30-day solicitation period followed by a 30-day period review for review and scoring. So again, this morning, the glide path to a Council A session should be one of the points of confirmation based on today's discussion. So with that, finally for your consideration, here are some lessons learned so far, including potential obstacles that we anticipate may be experienced by applicants based on our interactions this past round. For example, one applicant posted on social media about their concerns about potential litigation. In a governmental context, open records requests are another burden for vendors that could be predicted or expected given the delicate and very high-profile nature of this process. Routinely, smaller vendors face challenges navigating the city's process for solicitations and contracting. You may recall that we originally had the RFP open for 36 days, then extended it to 42 days. So we have received questions during the pre-submittal conference about whether advance payments are allowed. Typically, they're not. Again, we will defer to the council and lean on the technical assistance provided by the finance department to navigate this process. So with that, just want to say thank you for the opportunity to at least put this into context, and we'll be here to answer any questions that you may have.
Thank you, Dr. Jacob. In 2022, I filed a resolution with the mayor to discuss protecting the reproductive rights of San Antonio women. And within that resolution, it stated, the city of San Antonio formally condemns any action intended to abrogate the fundamental liberties of its people and affirms its commitment to protecting the rights of its residents to make reproductive health decisions. And part of that resolution was to ensure, whether it was our legislative agenda or with future budgets, that we prioritize investing in San Antonio's health and particularly with its women. And I want to thank the Metro Health team, of course, for all that you do with the last presentation and the one that we got later on the agenda as well, but assuring to the residents of San Antonio for their commitment to San Antonio women. I want to thank the folks who gave public comment as well, all the nonprofit organizations who helped mobilize community to ensure that there was the $500,000 earmarked for access to care. And of course, today we're discussing an additional $100,000. So I'm extremely grateful for the community organizers doing the work, and then of course my council members, colleagues on this committee for ensuring that we continue to reconsider this item to ensure that we have further discussion. Of course, my sentiment has not changed from the last time that this briefing came to council. I'm fully supportive of the $100,000 in the case that we do not have applicants that are applying with access to abortion travel in particular. My expectation direction is that it stays within the reproductive justice fund bucket to ensure that those resources are still accessible to folks despite how many applications we receive. And then this is more of a procurement point, and I made it during the last briefing. I think it's of utmost importance that we do not share any data related to individuals seeking access to care with these nonprofits, and that's my expectation. And I know there's HIPAA laws, so on and so forth, but I think it's important to emphasize that information and data won't be shared. But with that, this is an action item, and I'll hand it over to my colleagues for any thoughts, comments, or questions. Councilwoman Pedron.
I want to make a motion to approve, and then I'll share my comments. Second. Yeah. Motion to approve study session. So again, we're here again, and I know that I did this last last time, and I will continue to do this. Common reproductive health concerns for women include endometriosis, polycystic ovary syndrome, uterine fibroids, gynecological cancers, examples, cervical cancer, ovarian cancer, uterine cancer, vaginal cancer, vulvar cancer, traumatic experiences with sexual violence and sexual transmitted diseases, STDs and STIs. Stress is a factor for women, mental and emotional depression, all related to their reproductive organs. And what we're asking for is the correct amount to address these issues. And we know that my belief is it needs to be downstream, which is why we've done it, that I trust in the providers we're putting it out to are going to weigh in and see what they can provide to this council. And that is going to be on their decisions. We know that council members have an idea of what it should be used for, but at the end of the day, it's what you feel comfortable as an organization putting forward. And me supporting that to make sure that those of you that you are servicing feel protected and you feel safe in this process. So yes, we need this 100,000. We need to move it forward. I'm looking forward to seeing what programs they provide and what services they provide for us. And we need to make sure that we understand this is using taxpayer money responsibly, because one, women pay taxes. And two, when we look at the poverty rate, 20% of San Antonians live in poverty. Of that 20%, over 50% are women. And the first thing they're gonna say no to is their health care, which they shouldn't. So they rely on these organizations to help, and you're doing a very specific thing in terms of reproductive justice and what they do with their rights and their bodies. So I'm looking forward to moving this forward. I am looking forward to anytime we can spend more money on this issue, I want to. So thank you, Claude, again for bringing it. And again, I will be supporting it. And I'll have this conversation as many times as we need to. Thank you.
Councilman Dr. Court.
Thank you, Chair, and thank you, Chair, for agendizing the item today. I can't get over that there are so many people that think that they can say what women can do with their body. Individual self-determination is an inherent right that our country is founded upon. And until you have been in a situation where you don't have that access, you can't make a decision for what someone else should and should not be able to do, regardless of what faith you believe in. I cannot but think the level of privilege that folks have when they're speaking about whether or not this fund should be created. Very recently, I had a very close family member who went through a very traumatic experience, and her doctor was not able to give her the advice that she needed because of her getting care in this state. But knowing her situation and without divulging too much, she would have needed to, in a very short period of time, within several days, to get across the state to a place where she could actually get care. And we sat there and in that moment realized the level of privilege that we are in, because we would have known, we knew she would have been able to do whatever it took to get that care. And the amount of women in our community that don't have that privilege and would have had to live with potentially a baby that no longer exists in their body for months until they can be terminated. And that is heartbreaking. And it's heartbreaking to me that we would not make a decision to support women in all of our communities at any point. There have been arguments that have been made that I, quite frankly, don't understand their relevance to. I remember last time we had this conversation, there was an argument made that we wouldn't pay for cancer treatment in Houston. And I don't understand how that is anywhere relevant to being able to access a fundamental healthcare need. We, every day at the city deal with issues of lawsuits. Every day we defend our beloved officers who we honor even yesterday in situations where they are in. Every day we defend incidences that happen with the city. And if we can defend those, we can defend the women in our community that need this care. And so I absolutely wholeheartedly believe this is, I was hoping this work would have come out in the first round. But I am so grateful to Councilwoman Cabello Haverda. I'm not sure if she's still here, but so grateful to the Councilwoman for making this an effort to bring it up. I agree with Chair's remarks that it should, regardless of what happens, it should stay in the fund because we were hoping it would be budgeted in the next, continuously budgeted for, and we're hopeful that this fund will be a permanent fund and not something that we have to advocate for as a modification every year. But the last thing I'll end with is I've been thinking a lot about why this is called a reproductive justice fund and not just the choice fund. Because reproductive justice truly means that you have the right to bodily autonomy without interference of government. And I think that is super important that we give and make sure we protect all of the women regardless of which zip code that they live in and ensure that they get the access to health care that they deserve and were born with. And thank you all to the folks that came out and spoke. Thank you for those advocates. Thank you for my plaque that says San Antonio is a reproductive justice city. I love that. It's beautiful. Thank you, Chair.
Councilmember Dr. Rocha.
Thank you, Chair. Thank you so much, Dr. Jacob, and everybody for the presentation today. I have some questions. So the first one is with the upcoming SB 730, which prohibits the planning, training, or assisting with abortion travel. If or when it passes, what would happen to this item if that bill went into effect? Nothing closes.
Thank you, Councilwoman. This bill answered from the City Attorney's Office. For those that were in our briefing yesterday, you know that there is a current bill that's proposed, 730, that purports to restrict cities' ability to be able to spend money on abortion-related care. And so, to your question, Councilwoman, as we would with any other evolution of the legal landscape, we would ensure that we are compliant.
Got it. So what is the timeline for that? Do you?
The last I understood, based on yesterday's briefing, is it's just been filed, it's just been introduced, it has not been set. Session Saturday is in June, and so we will watch it.
Got it. The current landscape, Dr. Jacob, on slide 2, that includes all public funding, or did you say that also includes private funding?
Again, this was based on our own research, so it's a mixed bag. But what we know is different jurisdictions have made these investments and we try to at least organize these funds.
Okay, no problem. And then last time I had a question of where are we taking the $100,000 from? What area are we taking it from?
So based on the decision of council, we would have to identify that from within our current operating budget at Metro Health.
Okay, and then, so I know that there's a reduction in federal funding that could possibly affect us, and so that's why I asked that last time, and that's kind of why I'm asking again this time, because I represent a lot of residents with different healthcare needs, and I just want to make sure, right, that there's, do you have planned, have you started looking at to see where it might come from at all?
So yes, this is a constant process for us as we're already planning our FY26 operating budget. So we're looking at what would be the impacts for this if this were to move forward, and any adjustments since this was not budgeted for in this current fiscal year. So
would we be looking to also adjust the budget for the measles if we did for measles vaccinations, et cetera, out of the same budget or no?
Again, half our operating budget comes from external funding, and so we daily look at our needs and wherever we have to reallocate resources, but just know that based on what was adopted by council, we have a capitation on our current operating budget, and this would be a supplement to that, so we have to make the adjustments. Like anything else, if you have to take it from one area, then you have to offset it somewhere else.
Okay, great. Thank you so much. Thank you, Dr. Jacob.
You're welcome.
Thank you, Councilwoman Yeager.
And I hear the budgetary concerns, Dr. Jacob, but, is it possible, and the other reason I'm asking is because Councilman Castillo and I sit on the committee, the Sunset Committee, and I know that there are some, initiatives that and committees that possibly should be sunset and kind of, would that go to a committee to kind of talk about where we get that $100,000 from?
Again, I'll defer to the decision of council, but then I'll confer with the city manager's office, because again, for now, it's not in our current operating budget, and so we would have to make the adjustments accordingly.
Yeah, and I know I remember saying this last time, is we are gonna be facing federal cuts. And it is going to make an impact, but I think that is where we as a city need to prioritize. And if it is to prioritize people of color, women of color, those who've been impacted most by these cuts, I think we need to find the dollars. And I was, to see Harris County give $1.3 million, and that, for Harris, not for Houston, we know the kind of money that's in Houston. So I think we, as San Antonio, need to show that we are committed to this. So I'm committed as a council person to find that money, whether it's in off-system sales, whether it's in my own business, my own budget. Y'all know I'm always going to go off-system sales. I think you have enough council people that are going to look at their budget to make sure that Metro Health is okay. So thank you.
Councilmember Dr. Rocha.
Thank you. I just want to thank Councilwoman Villegas because I hadn't thought of that, but you're absolutely right. And so if there's an increase, then that might be the way to go. But I don't know how we would agendize it. I'm just again really concerned about how we document everything because I feel like all eyes are always on us. And so, but anyway, I love that consideration, Councilwoman. I just wanted to say kudos on that. But thank you, Dr. Jacob. Thank you.
Thank you. A couple of things, right, in terms of funding off-system sales. Yes, but right, like, I want to be frank, right, it's $100,000, and every Fiesta we order Fiesta medals that cost in the thousands. So I want to clarify, right, that we're not going to have to potentially cut vaccinations or that important programming to ensure that we provide the support that this request is seeking. So I just want to be clear that we wouldn't be reallocating from important programming.
Now, thank you for the comment. Let me just be clear. The last few weeks, it's no secret that the dependence and support of federal funding passed through the state to us. I don't have to tell you that it's been a turbulent season for us on the ground. So with that reality, all I can attest to is what we have in our current operating budget, and we would have to make the adjustments accordingly. So based on the directions from council and even the city manager's office, that's all I can tell you today, but this is not an item budgeted for this year.
Well, thank you so much, Dr. Jacob. Okay, so we have a motion and a second. All those in favor say aye. Aye. Motion carries. Thank you, Dr. Jacob.
Unanimous vote for it, even including mayoral candidate Adriana Rocha Garza. And everybody up for re-election, District 1 Councilman Carr, District 3 Councilwoman Villagran, District 5 Terry Castillo, all voted for advancing $100,000 for abortion travel.
Council Committee Chair, we have our pre-qualified public art list, and before I get started, I want to thank two key team members that have helped pull this together. We have Kimberly Morales, she's our public art program manager, she's right here. And then we also have Jordan Petrias. They worked very hard on getting our pre-qualified public art list together, along with a team effort of marketing individuals. So I just want to give them a round of applause. So I know come to you often about the pre-qualified public art list, but I want to go ahead and do a refresh on what that is. So it is a list of artists and support services that help us put a public art program together. When I'm talking about the public arts program, right now we have over 50 projects we're working on that are new projects, and we also have, since council provided us maintenance money for public art maintenance, we have between 20 and 30 maintenance projects a year. So these individuals help us maintain our public art that we have out in the community, but also create new public art. We'll have the 2027 bond coming up, and we'll also have airport coming up, so we need as many artists on this list to pull from when it comes to creating new projects in our community. And so these are the type of services that we have. We have individual artists who can design, and then we work with fabricators and installers. We have artists that can do the design, the fabrication, and installation. So we have a number of contracts that go with this public art pre-qualified list. And this is the very first step in terms of getting a public art contract. There's many approvals that happen after this. So the timeline, I just wanted to give you an overview. This past fall, we had applications open. I'll go over in a bit about our extensive marketing outreach, but we have informational sessions where people can learn more about the qualified list, how it works, how to apply. We had the applications open for a little bit over a month. And then we have evaluation and scoring applications. This is independent panels of art experts, not only mainly in the San Antonio community, but a few folks that are a bit broader, maybe in Texas or across the country, but mainly in San Antonio, but art experts that can evaluate the applicants to see if they meet the qualifications and the skills and expertise needed for this list. We also take it to our public art committee, which is a subcommittee of the San Antonio Arts Commission. Both of those entities did approve the list that's presented today. Then we bring it here to the Community Health Committee, and then finally, if approved here, we will take it to City Council with the target of March 20th as the date. And again, this is just an overview of the step process when it comes to the pre-qualified list. We have the applications, we have the evaluation, and then the third step is once the artists and the support services are on the list, we can pull them for artist selection panels for different projects based on those qualifications, because as you can imagine, every single public art project requires, it's so unique, so it requires a different expertise, skills, and a different aesthetic that these artists provide. These were our outreach efforts. The next slide will kind of go into how successful we've been with outreach, but not only are we doing emails, calls, communication to direct artists, also artist collectives, but we're tabling at galleries. We're working with all of our nonprofits, and we work with our city council members to get this out through all channels that we can. This is just a snippet of how many folks that we've worked with to get the information out about this pre-qualified list. And the past few years that we've done this, we've really seen a huge uptick in applications, and people know that this list exists and that they can work with us. One thing that I wanted to point out that was actually on the previous slide is that this application that we're looking at today and these applicants, we work with the Public Art Committee and the Arts Commission to say that they would be approved for a 6-year period. And why 6 years? Is because there's many projects that, of course, if you've been through, and I know we work with you all on our public art project, they take about 18 months to deliver, and we have a 5-year bond. So we want to make sure that the pre-qualified list and the artists aren't expiring on the list in the middle of a bond program or in the middle of a public art project. We want to make sure they're on the list for the time frame that's needed for all of our projects. This is a scoring rubric, and we did have, again, the application scored by independent panels. Artists are looked at for their artistic merit, their experience and qualifications, and also collaborations, because public art projects do take a series of collaborations. Then we also had some impact points for equity, so we looked at folks that are based in San Antonio, giving them up to 5 points. Then we had diversity, equity, and inclusion. This not only includes women, LGBTQIA+, but it also includes veterans and individuals who identify as disabled as a part of this scoring matrix. So here is the snapshot. We had 227 applications, only 40 less than the most number of applications we've received. So we're definitely getting out there and letting people know that this pre-qualified list exists. We have all 10 council districts represented, so we have artists from every council district. And 41% have not previously been pre-qualified, so it really showcases that we're outreaching to new artists all the time. And any of the applications that received a score above 75 or above 75 are being recommended. So we have 227 applications and 216 were recommended. So again, this pre-qualified public art list is a very particular list because it's folks who are really prepared to do public art and those services. So I think that's why we really see that there's just a small drop off on what's recommended because people really know what they're getting into when it comes to our informational sessions. We have 158 San Antonio area, that's the greater San Antonio metropolitan area, artists represented from this area. So again, a really great showcase of how much talent is surrounding us. And then we have about 58 non-San Antonio area artists. And if you look at the demographics overall, we've got a pretty even split when it comes to gender. You see the LGBTQIA+ represented here, and then also the next slide will really go into kind of the communities of color, especially in the San Antonio area. And we've been really, really successful again to really try to get our artists, especially from the San Antonio area, to be reflective of the greater demographics of San Antonio. So you'll see 40% Latino. We've got 8% that identify as Black, African American. We've got 3% Asian American. We have Native American, and then we did have 21% prefer not to answer, 15% white. So you kind of see the demographics here reflected of a good and healthy demographic when it comes to the San Antonio area. Now we're talking about a list of individuals and artists, and I really wanted to take a moment to showcase what that means, and it's best to showcase through their art. So we have artists here on the next few slides to showcase what kind of artists and what art we're talking about. So we've got Barbara Felix, who lives in District 1. I met her 7 years ago. She was a part-time artist. She's now full-time. She's done work with Centro San Antonio. She's been exhibited in a number of galleries, so really excited to have her on the list. We have Andrea Rivas. She's done a huge mural when it came to partnering with Luminaria in District 3. And then we also have Nina Jaramillo from District 4. She's a poet and an artist who really reflects on memories in San Antonio. And then we have Adriana Garcia, District 5. Adriana's work, especially if you'll see in that bottom photo, she was an artist that we worked with alongside the World Heritage Office on the World Heritage Center. The metal screen that's outside, beautiful artwork where she worked with designers to make sure that she had images of San Antonio reflected in the World Heritage images. And that's just a way that we're really working to mentor artists as well, to take artists who may be doing 2D or maybe familiar with murals to really work with the designers to incorporate artwork as a part of the building. And then we have Celeste de Luna in District 7. She's a fantastic artist that was part of the exhibit that was in Querétaro in Mexico. These are some support services examples that we have. We have Robert Diaz de Leon, and he's a blacksmith and artist, fabricator and installer. So not only can he design artwork, fabricate and install it, but he would be someone that we can look at if there's an artist who can just do the design, working with him to fabricate and install that design to make sure that it's viable for a public art project. And then we have, I think it's the coolest name, Blazing Laser. So they do a lot of engraving. They can do some engraving in sidewalks with artwork. They can do so many things when it comes to even engraving in steel. And these are just some examples of some non-San Antonio area artists to show how big our reach has been. We've got Dallas, Texas. We've got the region represented here with Jessica Bell, and then we have Fausto Fernandez in Phoenix. And then our outreach also made it to Dubai. So we have artists from all around the world that are really interested in being part of our pre-qualified list. So finally with that, today I'm just asking for your approval to move forward to City Council for March 20th to approve the pre-qualified list. And as soon as these approvals follow suit, we will get ready to notify the applicants that are on the pre-qualified list, and they will be eligible for artist selection panels that again go through a series of approvals, not only the artist selection panels that happen in community, but then the Public Art Committee and the Arts Commission also have to approve the artists before they can work on a public art project. And with that, I'm happy to field any questions.
Thank you, Crystal, for the presentation.